When I was 10 years old, I had a similar experience in Gastown, British Columbia, in the downtown east side in Vancouver. I remember driving in with my mom for the very first time and being shocked about the chaos and despair I saw even as a young boy. Anyone who goes to that neighborhood in Vancouver sees that chaos. Unfortunately now, that addictions crisis has spread right across the country and into every community in British Columbia. People are struggling, people are dying, and something needs to change. 15 months ago, this Liberal NDP government launched a WACKO hard drug legalization policy that has led to even more crime, more chaos, more drugs, and more disorder, especially in British Columbia. While the opioids addiction crisis has accelerated in severity in recent years, it isn't a new problem. In 2009, the BC Medical Association published a policy paper entitled Stepping Forward, Improving Addiction Care in British Columbia. The paper made 10 recommendations, including formally recognizing addictions as a chronic treatable disease under the Primary Care Charter and the Chronic Disease Management Program. Create and fund, this is crucial, 240 new flexible medically supervised detox spaces, and to fund the development of 600 new addiction treatment beds across the province. 15 years later, the availability of treatment beds has not improved. In fact, it's only gotten worse. Nowhere in that paper, though, did it suggest that making drugs like fentanyl, heroin, crack, and meth legal would help British Columbians. Today, the leading cause of death for youth aged 10 to 18 in my province is overdose. It's drug toxicity. Let that sink in. In 2023, more than 2,500 British Columbians lost their lives to illicit drug overdose. More than 6 British Columbians lose their life every day due to deadly drugs. Since 2016, 42,000 people have been lost to the opioid crisis across Canada. And since this Prime Minister took office, opioid overdose deaths have increased 166%.
Shocking.
The main argument this government has made in support of this reckless legalization, decriminalization policy was that it would reduce the stigma surrounding addiction. In reality, it has only made that stigma worse. Canadians are good people. They're compassionate people. But that compassion is evaporating quickly as crime and chaos increase in conjunction with the radical policies of this government. Let me give you an example. Last October, the Abbotsford Soccer Association published an open letter to the City of Abbotsford decrying the state of their fields and calling for change. And I quote, "The state of sport facilities, especially soccer pitches within the city, is nothing short of lamentable," the letter reads. It goes on, "The Abbotsford Soccer Association members are witnessing an increased incidence of individuals with substance abuse disorder loitering on the grounds of Matsqui Rec Centre, which has subsequently led to the increased presence of drug apparatus scattered on the fields and surrounding walkways, including syringes and needles, and shattered crack pipes and liquor bottles. It is not acceptable for any parent or any child to face those conditions when going to play sports." The letter goes on to outline that community parks are the most common place for children to be injured by dirty needles, and that children imitate behaviors that they see around them. In other words, what's happening at Matsqui Rec Centre is normalizing drug behavior, and kids are being exposed to that. This government knew from the start that their WACKO policy of allowing open drug use in public would put children at risk, and they went ahead with it anyway. That is shameful, and it is a complete dereliction of their duty to protect children. At the Legion in Mission, veterans have to clean up dirty needles and ask people to stop smoking crack on their property daily. It goes for every business in the downtown Mission core. It's like this government has created a crack tax because their windows are shattered. They have to have hazmat materials on site to clean up because of the possibility of fentanyl. In Mission, there was an addictions clinic operated by Dr. Lorena Reyes-Smith, which provided addictions care, STI screening, counseling, and more. Dr. Rhea Smith is a strong advocate for increased access to detox treatment and treatment of mental illness rather than the so-called safe supply model being pursued by this government in the province of BC. In October, she came to me distressed because she was forced to close her clinic due to high costs and a lack of support from the provincial government, which didn't understand her approach to wraparound care and the quality of care she gave those desperate to get off drugs and live a better life. Physicians continue to speak out that treatment funding needs to be under the same umbrella as primary care so that it can be billed to provincial health coverage, but that is frustratingly not the case. Even in publicly funded detox centers, patients are charged a per diem out of pocket, making it extremely challenging for those struggling with addiction to access life-saving treatment. Why isn't the emphasis on bolstering the number of addictions doctors rather than legalizing hard drugs and leaving people to die on their own? Why isn't the focus on building the infrastructure we so desperately need to address this crisis? The opioid crisis is not just limited to BC either. Last fall, the town of Belleville in Ontario declared a state of emergency after 23 people overdosed in 2 days. Belleville is only a little bit bigger than Mission. In a town of just over 50,000 people, 23 people overdosed in just under 48 hours. Again, let that sink in. This is the stuff being normalized in Canada. 13 of them took place in just 2 hours, I might add. And now this government is contemplating allowing more cities and provinces to make the same mistake British Columbia did. As a British Columbian, I am scared that this Prime Minister will expand this WACKO policy and that other provincial governments will make the same mistake we did. That is why the Conservatives today are calling for the government to do 4 things. 1, proactively and clearly reject the City of Toronto's request to the federal government to make deadly hard drugs like crack, cocaine, heroin, and meth legal. 2, de rejeter le vote de la Ville de Montréal demandant au gouvernement fédéral.
Reject the City of Montreal's vote calling on the federal government to make deadly hard drugs legal.
Future requests from provinces, territories, and municipalities seeking federal approval to make deadly hard drugs legal in their jurisdiction. And 4, end taxpayer-funded narcotics and redirect this money into treatment and recovery programs for drug addiction. Yes. Every day, 22 Canadians lose their life to this deadly crisis, and this government is only making the province worse. So I call on all members of this House to support our motion today and put an end to this wacko and deadly hard drug legalization experiment once and for all so that we can focus on getting people access to the treatment and recovery and supports they desperately need. Canadians love that our country is peaceful. They love an orderly country. That's being taken away from them because of this radical ideological approach. Let's bring our loved ones home, Mr. Speaker.
I want to thank the member for his comments. I actually truly appreciate that party opposite is talking about treatment, because treatment is a critical and definitely a core piece of our actions and our policy when it comes to addressing the overdose crisis. But actions speak louder than words, Mr. Speaker. Would this member commit to sustain funding on treatment, unlike the previous Conservative government that cut 2/3 of drug treatment funding?
The basis of that question is completely false. Under the former Prime Minister Stephen Harper, healthcare funding to the provinces increased on an incremental basis. We never reduced funding for healthcare. We provided the demands of the provinces and territories at that time. Thank you, Mr. Speaker.
Thank you to the member. First of all, I just want to acknowledge my condolences to all those who have lost loved ones from this toxic substance crisis. In particular, I lost my own cousin Peter in his 20s as a result of the toxic substance crisis. And I really would like for us to be talking about solutions on how we can help people. I'm wondering if the member can share why he's taking the approach that he is when we know that in British Columbia that has a person-centered, multifaceted approach, that the death rates have reduced in the last 12 months by 11%. Now we compare that to Alberta, who has a treatment-only model. Treatment is an important pillar, of course, and instead we are seeing the death rates in Alberta it's the leading province of death rates per capita, with Lethbridge, of course, being 3 times BC's death rate. And so my question is, do the numbers of people that are so tragically dying in BC versus Alberta contradict what it is that the member is saying in his speech?
As I outlined in my speech, the crisis we're facing is not just limited to British Columbia, but I think the real question the member from Nanaimo needs to consider is why her ideologically extreme premier, Mr. Eby, has done a 180 on this policy. And that goes to the very point I made in my speech, is that parents don't want drug addiction normalized in our community. Yes. Parents want to be able to go to downtown Nanaimo, to downtown Mission, to downtown Abbotsford, and access a recreation center without being fearful of being exposed to a methamphetamine. Thank you, Mr. Speaker.
Glad to hear the Conservatives have woken up to the poisoned drug crisis in this country. But when it comes to solutions, the reality is that Alberta has already done everything that they're calling for in this motion. And they have the largest number of deaths per capita in the country. And so, will the member meet with moms who've lost their kids to poison drugs so we can get some real solutions to a real crisis?
I wish the member from Kitchener Centre would follow my social media a little more closely. I've met with dozens of parents who have lost their kids to the overdose crisis. In fact, in the last year, I met with a mother whose son overdosed while at a treatment home because they allowed open drug use in the treatment home. That mother lost her child. Afterwards, on his 1-year anniversary, I went to a reception hosted by the mother to feed some of the people her son used to hang out with at the Diamond Hotel in Mission. And I asked some of the current people addicted to drugs and those that have beat addiction, hey, is Safe Supply making a difference? Oh, they said, oh man, this government's just laughable because we're just selling it again. It's a joke. It's a complete joke what's happened. They know it. We know it. We need to stop it. Thank you, Mr. Speaker.
Mr. Speaker, the Conservative leader refused to answer my colleague's question about the difference or definition of legalization versus decriminalization, which is an important distinction in this debate. Decriminalization does not systematically allow people to use drugs anywhere all over the place. It just means that the person isn't necessarily prosecuted. It means that they get adequate care because we see drug use as a health issue. So my simple question for the member is, does he think that drugs is a public health problem? The honourable member. The people in the bloc did not listen to my speech today. I said that it's a problem, and in the report I mentioned from 2019, I said that the government should start treating the problem of addiction like other chronic diseases.